No, you
Or
section
just
and leave the
section
pontic
over
on
it.
it,
Okay,
yeah.
okay.
Like I usually section the distal of the pontic, you
You
don't
just
see
give
it.
yourself a half a millimeter there or a millimeter between the two.
Yeah, just section it and the aligners will keep fitting over it and will move individually.
All right.
What's the other thing we can't move? Ankylosed tooth. How do you know if a tooth's ankylosed?
We can X-ray and look for the PDO. Tap on it.
Tap on it. Try to give it a banana. If it doesn't take it, it's dead.
It's short.
Okay, so it's going to tell you, like right here, are there any teeth that can't be moved? And you're going to say, don't move this implant, don't move this bridge, or don't move this ankylosed tooth. Okay? That way the software knows to not move it. What's the third question? Chief complaint. And we already know the chief complaint because it's what the patient told you or what you're concerned with. So if their patient's concern is diastema, all you're going to do is push spacing upper arch, and the software will address that. The very last question, the last thing you have to think about is called space distribution. And this is kind of an important question because a lot of times when you do ortho, you have what we call a tooth size discrepancy, right, Doc? Where you have maybe the teeth on the bottom arch are bigger than the top because the patient has peg laterals. And when I talk to patients about this, I use the shoebox and shoebox lid analogy. It's a great one. So if you have a shoebox, the shoebox lid has to fit over the shoebox to have it be a functional shoebox, right? What if the shoe box was too big? Could you fit the lid over it? What if the lid was too big? Could you fit it nicely over the box? So the upper arch and the lower arch are just like a shoebox and a shoebox lid, right? So if someone has peg laterals, what happens to the shoebox lid? It's too small, right? So what's the only two things you can do to get the shoebox lid over the box? Tell them.
You can make the top bigger or the bottom smaller.
That's the answer. You can make the top bigger or the bottom smaller. How would you make the top bigger?
Leave space.
Leave space. If they have peg laterals, where would you leave the space?
Both sides of the lateral.
Both sides of the laterals? What if they
You're
couldn't
gonna do
afford to
crowns
do
or something.
veneers? You could leave it behind the canine, right? You could leave it just on the distal of the lateral. But what I do with the two sides discrepancy peg laterals is I always leave space around the laterals. And in my comment section, which we're going to go upon here, I tell them to leave my laterals 3 degrees lingually inclined at finish. So I can do prepless veneers. Now follow me on this. This is a great trick. You ever do this before? So you have a case with peg laterals. You do Invisalign, you tell them leave space around the laterals, leave the teeth 3 degrees lingually inclined. You get to the end stage of your Invisalign, you scan in 3 minutes, you take a shade, and they send you back veneers. Do you have to temporize the prep veneers that you didn't prep? Do the teeth move? The laterals, are they going to move? What's holding them in place? The aligner, right? What's your bond strength on a purely enamel adhesed veneer?
Excellent.
Like the best ever, right? If you leave it 3 degrees lingually inclined, you don't have to prep it because you're not going to get over contouring. So if you ever do Invisalign and you're doing veneers, leave equal spaces. Remember that case I showed you, the girl missing the lower tooth? And I said, leave my space the same. You tell them, like, leave my spaces for my laterals the same exact width, 3 degrees lingually inclined with spaces around them. And then when you get to the end, just take an impression or a scan and put the veneers on and then make your retainers. It's really a cool way to do lateral veneers. But this last question is about just that right there. It's about where do you want, if there's going to be too big of a shoebox lid or too small of a shoebox lid, they want to know what you want to do with the extra space. Now we just said that if the shoebox lid is too small, she just said you would make it bigger, right? And do veneers or leave space. What else could you do if you wanted to make the lower arch smaller? How would you do that?
IPR.
IPR. So you would go in between the lower teeth and just like put them on a diet, slenderize them, like make them just a little narrower. And the software knows exactly how much to slenderize them to be able to get them underneath the shoebox lid. So whenever you have a two-size discrepancy, which if you look at the Bolton analysis, it'll tell you, like your mandibular arch is excess 2.5 millimeters. You're never going to be able to get that shoebox lid over it. You're going to have to leave space on the top and either put it behind the canine, put it distal lateral, or do veneers. I always choose veneers because I don't like to leave space because it lends to more relapse. Patients don't like to see spaces when they smile. You finish your laterals with a lot of veneers.
Yeah.
And it's just fun treatment. I have a bunch of cases I did that same thing. If we have time, I'll show it to you. Okay, those are your 4 questions. What arch? What tooth can't we move? What's your concern? And if there's a space issue, shoebox or lid, where do you want me to leave it? That's it, you guys. You got the photos, you push assessment, shipping address, billing address, which will already be on your doctor site once you have a login information. It's going to review what your 4 answers were. The monkey question is going to have your monkey answers. You said both arches. What does that say? I can't read it. 9/11 shouldn't be moved. Chief concern, crowding and spacing, and then impression tray replacement. So that's if you're taking impressions, they give you free trays. Because if you take, by the way, you need to know this. If you take impressions for Invisalign, you have to use their impression trays. They're these blue trays, you gotta use them, and they'll send them to you. Actually, they were sending them for free, but I think now, well, actually, if you're doing Invisalign, they'll keep sending to you, but they were starting to talk about charging.
I just heard this week that they're charging for it.
I think if you're not doing cases, you can't just keep ordering them, but if you're doing cases, they'll send them to you for free. Okay, so there's your questions right there, right? You either do a scan or impression, like we said. You submit right here your prescription, and then you will get back a ClinCheck with your treatment plan, right? And you know it's all green movements because you already did the assessment, right? Remember, we're going from pictures to assessment to then submitting a prescription to then getting aligners. Does everybody see that? Case assessment. If the case assessment's a go, as in green, then we're going to submit a prescription with those 4 questions, and then we're going to get back a ClinCheck, and you can actually start treating.
So would you print, if you were going to take impressions and you didn't have the scanner, would you print the treatment deal and the prescription and then send that in with the impressions at that point? You're submitting something, you're submitting that, but would you print that out so that they know who it is?
Yeah, if you submit impressions and pictures, the first thing you're going to get is an assessment.
Right, but for us, if we have the photos already uploaded on our phone, we've done that.
You don't
we
need to send anything in.
You're going to have to send in impressions, aren't you?
No, for the assessment I'm talking about.
Okay.
Yeah, the assessment you don't need to,
Right.
You can do it off of pictures.
But once you've decided you're going to move forward.
Yeah, then they either need a scan or impressions.
Right, but you need to send something with that paper-wise, is my point, in the mail, right?
Yeah,
So
when
they
you
know
do the
whose it is.
prescription.
Okay,
Yeah,
there you
for
go.
sure, yeah.
So I was just saying, you would print that out.
Yeah. Okay, so now we've said that the case is super easy, right? Like even, who can do it? Hygienist? Hygienist can do this as well as we can. That's how crazy it is. You can do this. All right, so now look. One thing I'm going to tell you is because we don't have enough time to be able to go over how you would do IPR or how you would place attachments. But on your doctor site, just go to attachments and watch the little 10-minute video, and they'll teach you exactly how to do it. Your staff this morning learned how to do attachments. Your staff this morning learned how to do pictures. Your staff this morning learned how to take impressions. So they're already like doing all your work. All you got to do is answer 4 questions and hand out aligners and put on a few attachments. All right, so you get that aligner back. This is what the template looks like to put on attachments. I'm not going to go into this, but basically they send you a mold that you put a little flowable composite in the little wells, which are the shape of the attachments. You put it on and you light cure. and you take the template off and you've got attachments on the teeth in the perfect spot, in the perfect shape. And we have 11 attachments that we use in Invisalign. Some are for rotation, some are for extrusion, some are for tipping, some are for translating, some are for whatever. But there's 11 of them, and guess what? You don't need to know when to use them, how to use them, where to put them, or anything. It's all going to be done for you. You liking that? It's brainless. Okay, so we're going to put the attachments on, and then if you have to do interproximal reduction, there's different ways to do it, but remember, it's just creating space in between teeth so that they can slenderize them in case you've got a two-size discrepancy, if the box is too big or the lid is too small. Then you're going to put the aligners over the patient's mouth, over their patient's teeth, show them how to wear them, and I want you to go on the doctor's site again for this, and it'll give you a 10-minute video on how to deliver aligners, what to tell them, how to take care of them, how to clean them, etc., etc. But basically that first appointment, you're going to give them the first set of aligners, and you're going to tell them to wear them except when they're eating, right? Remove when eating or drinking. I don't have them take them out when they're drinking because it's unnecessary. Unless you want to keep them crystal clear, it doesn't matter if you drink, iced tea with them. If you want, there is